Flu season will be a test run for the nation's biggest ever vaccine campaign. This fall, the U.S. will need to vaccinate huge numbers of Americans in the middle of a public health crisis. It will also be a valuable dry run should coronavirus shots arrive months later. Joining me now to take a look at what's going to happen is Dr. Sunil Joshi with the Duval County Medical Society and Family Allergy and Asthma Consultants here in Jacksonville. Doc, thanks for being here.
Yeah, my pleasure.
There's an effort to build a model to vaccinate people here for the flu. Could that model apply to COVID?
Oh, no doubt it could. I mean, I think the big difference, though, here is that the flu vaccine has been around for generations. And so there is, without question, an infrastructure for this. People already know, for the most part, whether they are or they're not going to get a flu vaccine. And it's given in pediatrician's office, primary care doctor's offices, pharmacies throughout the community, hospitals, the Department of Health, even our public school system helps to provide the flu vaccine. That infrastructure obviously is currently not in place for COVID, and that's the kind of thing we're going to have to develop as we go forward.
So federal health officials have offered little detail about their plans for administering vaccines. The U.S. said it will likely rely on the private sector. That said, there's a big challenge. You have a lot of people who are very skeptical, people who won't get a flu shot, a lot of people who won't get a coronavirus vaccine. And I'm not just talking anti-vaxxers here. How do you convince them otherwise?
Yeah, and that's a great point. And this is where education is going to come into play. Healthcare providers need to have the data and the information about these studies to be able to properly educate the population and towards the risks and benefits of any vaccine, but in particular, this vaccine, where there's going to be a lot of discussion about it. And so this is where we need to know that the vaccine has been studied in not just tens of thousands, but potentially hundreds of thousands of patients of different groups, different ages, different ethnic backgrounds, and understanding the side effect profile, the safety profile of the vaccine itself, which is why it takes so long to do these phase 3 trials to see what side effects occur over a period of time. If that is done through these vaccine trials and the FDA approves the vaccines because of that, then our job becomes easier in terms of educating people about it. But we do need to know that information and make sure the trials are done appropriately and the FDA approves the vaccine before moving forward. And then it really does become our job to educate people.
So this is no doubt going to be a daunting challenge. An entire population, as far as I know, has never been vaccinated before. So what efforts being made here locally?
Yeah, so I mean, this is where you hope to get proper guidance from the federal government or even state officials in terms of what to do in municipalities. But it seems like right now the trend is to kind of push everything towards the local governments to make decisions in terms of how they distribute these things. And so really it is up to us, healthcare experts, people who are interested in population health, to come together to develop guidelines in terms of, by looking at the data, to develop guidelines and advice to our local officials, to the Department of Health, in terms of who should receive the vaccine first, how it should be given, how it should be distributed, where, the locations, everything, all of the questions regarding the infrastructure of this large mass vaccination program will have to be done locally, or at least we have to assume it'll have to be done locally. And so we need to get a group of population health experts together now to make sure that we are ahead of the game by the time this vaccine is out.
So we're not sure yet. There may be one shot, there may be two shots. There's also going to be an education process.
Oh my goodness. So not understanding whether there's one or two shots is also part of what makes it, complicated for us as healthcare providers. But if there are two vaccines, one and then a booster, it's not just the challenge of getting people back for the second vaccine. It's also the challenge of finding the supplies, the needles, the syringes, the pharmacists or the people or the nurses to administer the vaccines that second time as well. So there are a lot of infrastructure issues that need to be put in place before this vaccine comes out for mass population.
And then there's the question with people getting reinfected. I think there have been 3 known cases, 1 in Hong Kong and 2 elsewhere. Is this going to provide the kind of protection that we need? So many questions, not enough answers. And I believe you may be back next week to talk about the flu season itself and the need to get the flu vaccine. So we'll be talking with you again. Dr. Sunil Joshi, thank you.
Thank you.